And it's been a goal of the San Antonio Eye Center now to help educate our community about the importance of eye health and care, and to support organizations that make a positive impact in our community. And at SA Live, we love to tell and brag about people doing great things. And here to tell us more is two medical professionals. Dr. David Abrams is with the SA Eye Center, as is Dr. Jason Ming. Hi, doctors.
Hello.
Hey,
Glad y'all are here. Tell us the goal of educating the community and why at the SA Eye Center. Dr. Abrams?
Yes. Well, one of the most important things is that most eye diseases can go undetected till very late in the disease. So part of our mission is to educate patients so that we can pick up problems earlier in the disease and hopefully make an impact.
Now, how do you do that?
Well, we have several ways. One is we have a website that not only gives information about our doctors and our practice, but has a lot of educational handouts and videos. So people can log on to sai.com and see all kinds of information about different eye diseases.
And Dr. Ming, have you seen this make a positive difference in visiting with patients and examining?
Yes, very good. We have our CEO open the website, they get all the information going on, and also we tell the patient, a lot of times the patient, we had good care, get the good eye care from us, they send those messages to all the relatives, friends, and they look at our website and also talk to the people. We explain to the patient a lot, that they get a lot of information from that too.
Many times they say the windows are the eyes to the soul, but they also can be indicative of other health problems, can't they?
Correct.
Very important. You got a good point. What happens is that we also tell my patients, some patients are sent by the doctor, the PCP, come over here. They say, I have a diabetes, I come over to see you. I don't know, the doctor sent you here. I'm seeing fine. But actually, by the exam, we'll find out they had diabetes in the eyes. And also the glaucoma, especially the glaucoma, people do not feel at the same time, at the early stage. When you feel the loss of the vision, it's already too late.
Okay. And there's nothing you can do about an ugly spouse, though. I mean, you just, sunglasses help with that. Is that how it works?
One of the other things we do, too, along those lines is we work with some of the primary care doctors and insurance carriers in the area to make sure that their patients are screened however often is appropriate, generally every 1 to 2 years.
Well, yeah, an eye exam is appropriate every year, and then for children, how often?
It depends on the age, whether they have any problems, but generally they should be examined once when they're very little, usually by the pediatrician, and then older kids, when they're ready for school, need to have a screening to make sure that they can see okay.
Yeah, and you should educate parents. I'm sure you guys educate parents about, watching for signs that maybe your children can't see. Mm-hmm. Watching television and having problems in school and those kinds of things. So paying attention to the eyes. How can we help our community with the SA Eye Center?
Well, we can help by making sure you talk to your relatives, friends that have chronic disease, especially diabetes, like Dr. Ming said, and make sure that they're taking care of themselves. Because a lot of times we see people that maybe because they have a sick spouse and they tend not to take care of themselves until it's too late to do.
Yeah, don't put anything off.
Exactly.
And then regular eye care for those that wear glasses or contacts even. It can be very dangerous if you develop, things that are unhealthy.
And sometimes we see people, they'll go to a corner store and buy cosmetic contacts and they don't even realize what they're doing, and they end up coming in with all sorts of problems.
Well, you need to protect your eyes. Thank you all for what you do in the community. We want everybody to go to your website, sai.com, or call 226-6169, and thank you for educating our community, taking care of local people. It is great.